Does this sound familiar? Your pregnancy has been going smoothly. Every day you go for antenatal visits. Your doctor tells you you're fine. Your baby is fine. Until one day he tells you your blood pressure is high and won't be letting you go. You have to stay back to be monitored. Do you know anybody who has had such experience? And I want to tell you that it's not just about the number. Blood pressure rise in pregnancy can have far-reaching effects all around the body, from the head to toe. So this video is very important. I'm going to telling you about pre-eclampsia. What causes it? Why it happens? How you can recognize the signs and what you should do if you have been diagnosed with preeclampsia. This video is very important. Stick around. If you're going to get value from this video, I want you to subscribe and also share this video to friends and women around you. They are going to benefit from this video. So let's go. Pre-eclampsia. This word, pre-eclampsia. I don't mind the term, but it is not just about elevated blood pressure. It is not just about the number. Oh, your blood pressure is more than 140 over more than 90 or more. That number represents something that is far-reaching from affects that can affect the brain, affect the kidneys, affect the liver. It has a far-reaching effect. Why does this happen? And it's also important to know that when it is diagnosed after 20 weeks of pregnancy, after 20 weeks of gestation. For women who like to count in months, about 5 months of pregnancy, after 5 months, that is when this condition manifests, because the site of this condition is the placenta. What causes it? When your baby is forming, when the pregnancy is forming, the uterine vessels, the blood vessels in your womb, are supposed to allow that of the placenta to enter it. But this doesn't happen well. And when this doesn't happen well, it sets off a process, it sets off some signals all around your body, all around the arteries and the vessels in your body, and then they start to manifest certain signs that eventually leads to the blood pressure rise, and certain factors can occur. Who is more likely to have preeclampsia? If you have had preeclampsia before, there's a chance that you can have it again. But this information is not to scare you. This information is knowledge, and knowledge is power. Because when it has happened before, your healthcare providers and doctors are better equipped to help you and make sure do all they can so that it doesn't happen again. For some other people, if you have had hypertension, your blood pressure was already high before you got pregnant, it places you at risk. Or you had diabetes in the past before you got pregnant, that is something your doctor should be paying attention to. Also, if you have more than one baby, what I mean is you're pregnant for twins or more, congratulations. The doctors will pay particular attention to. Also, obesity. It's important that that is taken care of. For some other people, they are likely to have hypertension, but not as much. They are likely to have preeclampsia, but not as much as in this group I mentioned. For instance, if your father or your mother is hypertensive, or even your mother had preeclampsia when she was having children, you may also be at risk. But it's also important to know that it can happen to any woman. What do I mean? Preeclampsia can happen to any woman, even a woman that does not have any risk factors. This is why this video is important, and this is why this video is important, and this is why you need to make sure you share this video with your loved ones, your sisters, so that they know what you know and you don't hold knowledge. And this is also the time I'm going to ask you to try to subscribe to this channel right now. Subscription is free. Like this video and share it. So let us go to another crux of the matter. The crux of this matter is, how do this preeclampsia, how does it manifest? Before I go into that, I'm going to tell you that preeclampsia is not if you have had it before, it is not your fault. Your body did not fail you. It can happen to anybody, as I have highlighted in this video. Absolutely anybody. First time you're pregnant for the first time, when it is more likely to happen. Yes, it can happen. You can also have had two pregnancies and this is your third pregnancy and then it happens. It does not mean that your body has failed you. And it doesn't mean that there's something you were supposed to do that you did not do that made it happen. So free yourself of the guilt, okay? Preeclampsia can happen without symptoms. Remember what the scenario I created in the beginning of this video? It is actually very common. It happens like that many times. That you may feel no symptoms at all. Yet your doctor is telling you that your blood pressure is high. It's more than 140 over 90. So you're wondering, but I feel fine. In fact, some of my patients, the blood pressure can be up to 180 over 110 or more, and they are fine. And when you're saying we need to stay back so that we monitor you, it's like, doctor, you don't know what I just came out from work to get this done and go back home, and you're telling me I have to stay back now to have my blood pressure checked and have my baby monitored. Please cooperate with your doctors, because the next thing they want to do when we see that your blood pressure is high like that is to check your urine. Preeclampsia makes proteins to leak into the urine. They are affecting the way the kidney works. Protein is not supposed to be seen in your urine under normal circumstances, but preeclampsia can make protein to leak into your urine. So When protein starts leaking into your urine a lot, that is also a sign that something is happening. This is not what the kidney should do, and it is doing it. So add that together with the elevated blood pressure, that tells you something. Even though we do not have to even wait to see blood protein in your urine, there are other signs you can have. Headaches. If you're having persistent headaches, you think, oh, I'm stressed, let me rest. You wake up and that headache is still there. Please, you need to talk to your doctor about it. Or if your eyesight is beginning to become blurry, it feels like there's a vein or something in your eyes and you're not seeing very well, that is another time to see your doctor. Or there's pain under your around your right rib, just here below. Can see the place I'm touching? Yeah, around there's pain. You need to see your doctor. Some other women notice reduced urine. Right, your urine volume is reduced, and even the color may be changing. This is an opportunity, and you don't even need to wait till your antenatal visit. And it's also important that you know that in between your antenatal visits, you can go to the health center or health post around you, depending on where you live. So just get your blood pressure checked. In many parts of Nigeria, it doesn't cost much to have your blood pressure checked, and then they give you an idea. They tell you what your blood pressure is, and if it is elevated, you don't need to say, let me wait till my next visit. Carry yourself, take yourself to the hospital, or call your doctor or midwife, depending on what is available where you are. Remember that preeclampsia, the central problem is at the placenta. So the placenta has to go with the baby. Even if, when I say go, I mean baby has to be delivered. Even if your baby is not up to 10, even if your baby is not up to 37 weeks, or like some of you like to say, my baby is not up to 9 months, doctor, what do you want to do? Just give me blood pressure medicines. Now I'll be taking them. I'll have bed rest at home. I'll rest. No, it is beyond just the number. So right there, when you come to the hospital, we are going to want to do some other tests for you. Because remember, I said that preeclampsia affects different organs of the body, liver, kidneys. So we want to check even the blood. So we want to check, draw some of draw your blood, a sample of it, to assess whether all these areas are still fine, and that helps us to take care of you. In addition to the blood pressure medicines we'll be giving you, there's also a critical medication called magnesium sulfate, which is critical because one thing about preeclampsia, because from preeclampsia it can go to eclampsia, and that is when there's now convulsions, you know, generalized convulsions that can happen. And when that happens, some women go from convulsions to unconsciousness. So we don't want that to happen, from pregnancy to requiring intensive care unit admissions. So this is why when preeclampsia is diagnosed, we want to say, okay, ma, fine, we need to protect you. We need to protect you and bring this pregnancy to an end so that you start to recover. Some women even lose their sight because of preeclampsia, even though in some women it is reversible. After a while, it gets better. So you see, this is not something to joke around with. For women with preeclampsia, it's important to know, and I'm telling you now that this video is not for you to diagnose yourself. It's for you to draw your attention, bring your attention to what you need to know, so that if you have these signs or somebody around you has these signs, you tell them, I saw a video about preeclampsia, let's talk to your doctor. And then it's not for you to take your neighbor's blood pressure medicine or things like that. No, it's need for you to get yourself to the hospital. So share this video so that your friends know what to know. For prevention, yes, prevention. How can preeclampsia be prevented? Very important. Depending on your risk profile and some other things your doctor or the healthcare provider will check, they may recommend what we call low dose aspirin for you. Now, I know some people, they'll say, I don't know whether I'll have it or not. Let me just start taking. No, it is not in your best interest. It has to be recommended for you. They need to know whether it's a good fit for you to take it. So this helps prevent a great number of cases of preeclampsia and also prevents the early births associated with it. So in conclusion, preeclampsia is a disease every woman needs to know about, to know the signs, what to rush to go to the hospital, and how it is prevented, so that you also take note of that. Remember that lifestyle modification is important, cut out refined sugars, and everything will be fine. Thank you for sticking around. See you in the next one.